How do you request blood tests? So from now on, you launch this template called Request Tests. It should be on your toolbar, and the icon is of a test tube with numbers around it. On this template, you tick the blood tests that you want to have taken. You can type in with free text any other blood tests that you need, and you can also put in clinical comments there. There are options down here to text a patient a link to book themselves in, or if you prefer, you can tick this box and it will generate a task straight away to go to reception. Click OK. Task comes up. OK, that job done. How do you request tests for the future? So, same as previously, you tick the blood tests you want, but the only difference now is that you click on this drop down and you set the date you want the blood test to be due. Now let's say I wanted the bloods in 3 months time, perhaps mid-June. It's better to allow a few weeks for the patient to be invited. That's because they won't be invited until the test is due, and the test won't be due until that date is reached. You can also see down here that a HbA1c has already been requested for the 1st of June. So I could choose to align these blood tests with that date. Unfortunately, you do have to set each different blood test for the correct date, but then that does mean you could have some blood tests that you want now and some that need future dating. There's no need to create any scheduled tasks or do anything else. Clinical reports will find the patients who need the invite when this date has come, and they'll be automatically then texted with an invite or sent a letter to book themselves in. How will these blood tests then be taken and the information passed on to the HCA? HCAs will be using this template, the recall overview. This patient is a test patient, so it doesn't come in for many bloods, but has lots of things they need. So there's a long list of blood requests. Any requests that you've added will be combined with bloods that are needed for any kind of monitoring. You can also see here the other specified withdrawal I've asked for and the clinical comments to display. The HCA can also see who exactly has requested those bloods, so they know that's the person to assign the bloods to. If they want to see a bit more detail about why these blood tests are needed, further down here you've got a section that shows the different monitoring in place, the medications that are required, different monitoring. You can see here that ad hoc bloods have been requested. This patient has 3 monthly FBC monitoring. He's in currently lots of different prostate cancer groups and lots going on. But the key point is the tests that you've requested will appear in this screen along with the notes that you've added.